Hi, as promised, let's talk about stopcocks today. A stopcock is a valve that is used to control the flow of liquids and gases. By control, you can stop, you can start, you can redirect, and it also gives you options of where you let your flow go. As we talk about the applications, it will make more sense. So there are different types. There's a one-way stopcock, two-way stopcock, three-way stopcock, four-way stopcock, at least to my knowledge. But I'm going to focus on the three-way stopcock because that's the one that is most commonly used in the hospital, and this is what it looks like. So there are different brands, and some of them are better labeled than the others. So like this one right here, you will not be able to see it, but this long lever, let me call it a lever, this long one right here, it says off on it. And these shorter ones right here, some of them have arrows. So what this means is that this one, like this place where it says off, that means fluid cannot flow in this direction. And then these ones that have arrows, that means fluids can flow in this direction, can flow in this direction. It can flow in this direction, but it doesn't count because there's no port here for the fluid to come out. But just know that the basic idea is that when it is off, anywhere it is off to, fluid cannot flow there. But anywhere it has an arrow pointing, or these three things here, that means that fluid can flow on that. So now let's start talking about the applications. These are coverings. You have to take all this off and to be able to use it. Okay, so you see it has a lower. This is a male lewer, this is female, and this is female. So two females and one male. So what can fit into this one is a female. What can fit into this one is male. Likewise, this one. So now let's talk about the applications. One way it can be used is to give medications that have very short half-life. So you want to push the medications very quickly. An example is adenosine, which is a medication used in emergencies, to treat SVT. So you want to push it very quickly because it has a very short half-life, and you know that it has to go through the tubings before it goes to the heart and do its work. So you want to push it quick and then follow it immediately with a flush. Now, if we are going to pretend that this is a tubing that goes to the patient, this is an IV extension tubing. So under your catheter or cannula, this connects to it, and then you connect whatever else you want to connect. So let's put this in here. Oh no, this is the wrong way. Okay, so we tightened it. This is tight, so it doesn't come off. Now, to give that medication, the adenosine now, remember this is off and this is open, this is open. So you take a flush, that's just normal saline, and then you take the medication and put it here. So sometimes two people do it. So one person pushes this and another person quickly, because you have to push it very fast. Half-life is less than 10 seconds. So what happens is that you open this, push the medication, close, and push immediately. So you see that you don't need to, if you were going to use just one syringe, you have to unscrew, put again. So that takes a lot of time. So that is one way of using this. Then another way is if you are going to give small doses of medications at intervals, maybe like when you are giving anesthesia or you are giving small doses to pediatric patients. Let's say this is the whole medication, this is a 10 ml syringe, so you put it here And then you take a smaller syringe. Suppose you want to give 1 ml at a time. This is a 1 ml syringe, so you put it here like this. This is closed here. So then what you do is that you close this. This is now closed. You close this, and then you pull this. So it comes in like this. You pull this. It goes. I just hope you guys can see it. So with that, you have measured exactly 1 ml. So it lets you give your 1 ml exact volume, and it's also convenient. So you can now, if you want to give it, you now turn this thing here, close this big one here. You know, there's a lot of medication here. Close this big one. This one is now open, and then you push it. You leave the syringes there. The next time you want to do the same thing, you do the same thing. So you keep giving it in 1 ml dose like that. So that's another way to use it. Then another way to use it is you can use it to mix medications. So let's say this is a medication, and let's pretend that this mouthwash right here is another medication. Okay, you put it this way. You close this. You remember the long one is for closing. You close this and you do this. Push, 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 push. You see now, you've mixed that. So that's another way to use it. Then another way to use it is for declotting a clot. Maybe if your line, your IV, your central line especially, is clotted with blood, you need to give a thrombolytic to break that clot so that your line becomes patent. Now, sometimes it's complete. You can use just one syringe. If it's not completely clogged, it can let you push the thrombolytic inside. But if it is completely clogged, you cannot push it inside. So what you do is you use a stopcock. You use, let's say this is the medication right here, the thrombolytic. You put it here. Okay, and then you use an empty syringe and put it here. Close the thrombolytic. Pull on this right here to create negative pressure. When you do that, then you open this, and then this starts to go. It goes in. This pressure here will pull it in, and it goes in and breaks your clot. So that is another way to use it. So this is mostly with IV. Now there are special valves, stopcocks now, that are used with feeding tubes. So they are called Lopez valve. This is what it looks like. This one is bigger. You will see it says off here. There are 3 arrows here. So these 3 arrows means this is patent, this is patent, this is patent, and this is closed. So you see the same idea. So this part goes to the feeding, maybe NG tube, PEG tube, Doppler, whatever it is you are going to use to feed your patient with. You connect it here. Then this place goes to the feeding itself, the tubing that attaches to the feeding. So you attach it here. So when it is like this, it is close to the feeding. When it is like this, it is close to this port here. And this port is for medication. So you open it, put your syringe, and push your medication this way. So you don't have to stop your feeding or disconnect your feeding. Rather, you should stop your feeding when you are giving medication, but you don't need to disconnect it. You can just off it with this, and this becomes open, and you put your medication here. Okay, so this is off, your medication goes through here, and this thing is easily lost. So whenever you are not using it, you can just put it here like this. You see, it sits in the middle of this like this. Just leave it there. Whenever you are done, you take it off and cover it again. So this is another type of Lopez valve. You see the off and the 3 arrows again. The 3 arrows showing this is open, this is open, this is open. This place you put your medications here. This is an ENFit Lopez valve. So there are special syringes that fit into this. It's not every syringe that fits into this. So which is why it's called ENFit. So just the same idea. This goes to the patient. This goes to your tube feed. This is for medication, and this controls. You can stop, you can start, you can redirect, just what the stopcock does. Okay, then other uses of the stopcock is that it can be fitted into the balloon ports of an endotracheal tube, to control the air that goes in that cuff. So you can fit it in. Say maybe this is the one that goes to the cuff. So you can control, you can use syringes, take it out, especially when you want to do it quickly. Take the air out, push the air in. So you can do that. Then another way you can use it is with drains, chest tubes and drains. So some of those chest tubes, you connect it to this, so you have two ports. You have to access to the chest tube. There are times when you will need to declog your chest tube too if it's blocked. So you still use the same. You can push your medication here and flush here. You might be required to flush some of these catheters that are coming from your patient. So you can use these stopcocks. Like this place will be attached to the drain. This place you attach your syringe here. Then you close the drain. When you close this, you close the drain. And then your tube is here. It's patent. So you push your flush here and it goes to the tube. It does not go back into the drainage bag. If you want to flush the tubing of the drainage bag, you do the same thing. You close this. This is open, this is open. So you push a flush here and then it flushes this. So those are the ways it can be used. Then it has many uses in the ICU. In the ICU, it's attached or incorporated to pressure lines. Pressure lines are lines that are used to measure pressures in the heart, intracranial pressure, abdominal pressure. So we will talk about that at a later date, but this is what it looks like. This is a segment of a pressure tube, and you will see that it has a stopcock incorporated to it. Then pressure bags, it is also used in pressure bags. With pressure bags, you use it to create pressure inside the tubing. So that also has a stopcock incorporated into it. I don't have a bag right now to show you. Then again, in the ICU, it can be used as a manifold. In the ICU, you give a lot of medications to one patient at the same time. So you can get 3 of this. This is just 2 I have here, and connect them to each other. You can connect another one here. So that gives you 1, 2, 3 ports where you can connect your drips and they will all be going in, instead of having multiple lines. And make sure that these medications going in are compatible. So those are some of the uses of the stopcock. I had to rush through it and it's still over 13 minutes. Thanks for listening. Make sure to like, share, subscribe and follow for more. Leave comments, questions, suggestions. Thank you for listening. Bye.